Getting trained in psychology and being in practice and all can go down so many different paths and impact so many people where the people that we're actually working with one-on-one become teaching tools for millions of people that might be reading about it or watching it. But that does change the way that you interact with that person, right?
Yeah, absolutely. I think that that's what I'm trying to do is exactly what you said, which is to really bring emotional health and well-being to everybody, to make it accessible for everybody. And so I think when we're working one-on-one in the room with somebody, we have a great impact, but we also can bring that to people who maybe aren't going to go to therapy, but really want help with their relationships with their parents, their children, their, figuring out the relationships to themselves. And I think that that's so important that everybody has access to that.
You make a really great point where you say the story people come to you with in the beginning is typically not the story it winds up being about and not the story that you end with at the other end. And of course, that's the therapeutic process, but you describe it in a way people can understand. They come to you with a story and they're not reliable narrators. How do you go about getting them to reevaluate their story and change that narrative?
I think you have to ask the right questions. And I think that people don't know what questions to ask themselves because they're very married to their story. And they feel like they're very stuck. And the reason they're stuck is because there's something faulty in their narrative. And so, my job sitting with somebody is to help them ask themselves some questions that they haven't been able to do. I think that a lot of times we don't ask those questions because of shame. I think that we feel like if I face the truth of something about myself that maybe I'm not proud of, I'm a bad person. And we really want to distinguish between, what it means to do something, which is different from who you are as a person. So a lot of times people don't tell you the whole story. They minimize certain things. They spend a lot of time talking about what other people have done. And we really just want to humanize the fact that we are all imperfect people, that we grow and change because of these imperfections, and that really being honest with ourselves and with the people in our lives is going to free us from whatever is ailing us.
Yeah, and your book, I want to really encourage people to read this book. Maybe you should talk to someone. I highly, highly recommend it. But in this, you talk about that there's a common theme to their stories that include an element of emptiness and disconnection. No matter how many people are in their lives, whether it's work, family, extended family, or whatever, that a lot of these narratives that people have, they don't feel connected. They do feel a sense of emptiness. And I get a sense from a lot of the people that I talk to of them putting themselves in a victim role in that regard as well.
Well, I think this lack of connection is a big theme, especially now. And, I should just give this some context to say that in Maybe You Should Talk to Someone, I follow the stories of four seemingly very different people that I see in therapy. But there's a fifth patient in the book, and that is me,
Right.
as I go through therapy with my own therapist. And I did that because I say at the beginning of the book that my greatest credential is that I'm a card carrying member of the human race, that I know what it's like to be a person in the world. And I didn't want to be the expert up on high because I truly believe, especially as all these years as a therapist, I've seen that we are all more the same than we are different. And so I think that when people are struggling with something, whatever their issue is, there are real issues that they're struggling with, very kind of discrete issues. But underneath it is often this sense of not enough connection. How are their lives peopled? And are those relationships nourishing them? So they might have a lot of people in their lives, but they might not be nourishing because they're operating on a superficial level, or they're having a lot of difficulty with getting along, or they aren't opening up, they're not being vulnerable. So there are a lot of reasons that we feel disconnected. And I think part of it has to do with we feel like whatever we're going through is that we're alone in it. And we don't talk about our emotional health as much as we need to, in the sense that if something happens to you physically, like let's say that you fall down and you break your arm or something. We're going to go to the doctor for that. And we're not going to compare it to something and say, well, it's not like I have whatever it is, stage 4 cancer or whatever, something that you think is more severe than that. With our emotional health, we say, yeah, I don't know. I'm feeling like disconnected, or I'm feeling kind of sad, or I just, something's off. But, I have a roof over my head and food on the table, so it's okay. I'm not going to get help for that. We don't have this hierarchy of pain with our physical health. We get help, but with our emotional health, we do. So if you're having chest pain, you're probably going to go see a cardiologist before you have a heart attack. If you're having emotional pain, the people who come to my office are usually having an emotional heart attack. They didn't come when they were just having the equivalent of the chest pain. And now, first of all, it's harder to treat because now you're like, it's really gotten bad. But secondly, you suffered unnecessarily for a long time when you didn't need to. So I think part of the disconnection is that we don't realize how important it is to tend to our emotional health, not when it gets really bad, but to make that a part of our lives, to make that a priority.
Yeah, and I think we have to own that, because one of the things that I think we're really deficient in society-wise is we don't do anything in the educational system to teach kids to recognize red flags in their mental health. We don't teach them what you're feeling might be anxiety or depression or some other mental health anomaly. We don't teach them what that is. We don't teach them how to recognize it. We don't teach them what the resources are. We don't teach them how to avoid the stigmas associated with that. And there's a counselor in every school, but they just are pretty passive. They sit there and wait for somebody to come knock on their door. They're not proactive in most cases. And there is a stigma. If you're seen going into the counselor's office, you're like, well, what's wrong with this person? And they're kind of ashamed of it. I think we have to do a better job of saying, look, this is something that you need to learn about and recognize. It's been a long time since I've been in private practice, and I so admire those people that do it. When I was in private practice, one of my most eye-opening experiences was that I had people that never knew they were depressed until they weren't. I had people that came in and they didn't come in because they were depressed. They came in because of a marriage or their kid was on drugs or something was going on. And they never knew that they had depression until it lifted and they began to say, oh, wow, the sky is blue. There are people around that care about me and that I care about, and I have energy for my job and my family. And all of a sudden they said, what's going on? They had lived years being depressed and never knew it, and said, Doc, what's happened here? What's going on? How many people are living with depression and don't even know it because they don't see the red flags and have not labeled it?
Yeah, I'm just nodding because that's exactly what I see in my practice. Is so many times people do not know how to identify what's going on with them. And if they've been living with depression for most of their lives, they just think that's life. That's normal. They don't know that there's something different. They think, oh yeah, the problem is that I keep arguing with my husband. They don't know I'm also depressed. And so, and anxiety. Sometimes people do not know that they have severe anxiety that is really getting in the way of their functioning in a way that they finally see when the anxiety is dealt with. I think when you talk about that kid going into the counselor's office at school, we see that as a sign of weakness, but really it's a sign of strength. That kid is saying, I want to get help for this. So whenever somebody admits that they need help, that it takes so much courage, so much bravery. And I wish that in our culture, and I think it's changing, but it has so much farther to go, that we could see that when somebody wants to do something for their emotional health, that person is extremely strong. They're not weak, they're strong.